Hello, this is a presentation of my pediatrics case. My name is Sandra Arias. Today I had the pleasure to examine MJ. MJ is a 10-month-old male child brought in by his mother. The mother reports that a week ago, after MJ ate some scrambled eggs, he developed a rash. A rash was in his chest and his face. About 15 minutes after the rash was developed, the child began to vomit in a projectile manner, and there were no other symptoms besides the rash and the vomiting. So the mother administered Benadryl, which resulted in an improvement of the symptoms within an hour of administration. And then since then, the child has not experienced any other symptoms or complaints, and the family is concerned about the rash and would like to investigate further. Nothing appeared to worsen the rash, and the child appeared to be experiencing pruritus, but no other symptoms. When asked the family about the medical history, the child has not had any prior medical history, no prior surgicals, and no medications. Allergies, there were none to medications, environmental, latex, or foods. And for family history, mother is 28 years old with a history of asthma. Father is 36 years old with a history of hypertension. And MJ has a 5-year-old sibling, female, with no medical history. The child lives home with his mother. Mother is a teacher, and father works in construction. He attends daycare 4 days out of the week, and on the 5th day, his grandmother cares for him and his sister. Upon the review of systems, everything was reported as negative. The only positives were the disseminated rash on the chest and the face, and the projectile vomiting 15 minutes after the ingestion. The height, weight, and developmental stages are all reported within normal ranges by the pediatrician according to the parent. And at the clinic, we measure the height, the weight, and head circumference, and they were all plotted within the 60th percentile. So at this point, the differential diagnoses in my head are an allergy to egg, contact dermatitis of unknown origin, a bacterial foodborne intoxication, food intolerance, GERD, or a viral or bacterial infection. In order to rule out these potentials, then I completed a head-to-toe assessment with focuses on skin, chest and lungs, cardiovascular, and abdomen. The general appearance of the child was well nourished and no acute distress. There were no rashes, edema, or erythema noted on any of his extremities, head, back, abdomen, or genital region. Chest and lungs were clear bilateral with no cough, and cardiovascular, his rhythm was normal, no murmurs or gallops noted. For his abdomen, he was soft, non-tender, bowel sounds were present, and no masses were noted. Everything else about his exam was unremarkable. So after the physical exam, I proceeded with my plan. My plan was, since I'm currently working at this clinic that has a component to immunology, was to suggest we do a skin prick test, which can be completed. It's a dermal test. And the test was completed upon the completion of the visit, and his allergy testing was positive for egg allergy. After receiving the positive results from the testing, part of the plan included educating the parents to avoid these egg products of unbaked forms, such as scrambled, hard-boiled, fried, or uncooked, but reiterating and confirming with the parents that it is okay to provide the child with a diet that contains baked eggs, and to continue to try other foods like they have continuing to do, and to ensure that the child is receiving proper nutrition. Also provided training to the mother of the child on how to use an EpiPen in case of an anaphylactic reaction, and educated the family on how to read the food labels properly to ensure that they're avoiding the allergen. Educating the parents on severe allergic reactions and the steps to take if this was to happen. As far as medications or prescriptions, an EpiPen auto-injector was prescribed for the child, and over-the-counter antihistamines for mild itching or rash, if needed, were also discussed. The follow-up includes discussing any other symptoms that the child might develop down the line with other foods, and also discussing the findings with the pediatrician to make sure that we have a collaborative effort in managing this patient. The follow-up with asthma and allergy was discussed as far as atopic dermatitis, asthma, and allergic reactions being a part of the atopic march. And we also explained to the patient and the family the pathophysiology in this particular case, which includes the immune system identifying certain proteins as harmful, in this case the eggs, even though that they are indeed harmless, and it triggering an immune response leading to the release of antihistamines, which in this case were the rashes and the reaction of vomiting the substance. These immune responses can manifest in different ways and different symptoms, and we also discussed how they can manifest in a form of anaphylaxis. After education, the parent was also provided with handouts to be able to review this information at home and share with other friends, family, caregivers that would also need to understand the utilization of the EpiPen and the avoidance of the allergens. And that's the end of the case. Thank you.